Welcome to Vet Candy, where we talk about the hottest vet news. Thanks for joining us today. We are super excited to be here. I'm Dr. Michelle Moyal, an assistant clinical professor at the College of Veterinary Medicine at Cornell University, and my focus is primary care surgery.
And I'm Patrick Carney. I'm an internist, an epidemiologist, and also an assistant professor at Cornell. My teaching focus is on primary care.
On this episode, we are talking about parasites.
One in two dog parks have worms? Interceptor Plus is a monthly chew that protects your dog from not only heartworm disease, but all 5 major worms. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
So Patrick, where are the top cities for parasites? Turns out the Companion Animal Parasite Council, CAPC, which is how we lovingly refer to them, the nation's leading source on parasitic diseases that threaten the health of pets and people, issued the top 10 cities that had the highest percentage increase in positive heartworm tests and other parasites. Let's count them down and discuss.
Sounds good.
So Patrick, part of the counting down of these cities that CAPC put out, one thing I want to focus on is roundworms. And the reason why is because we see it super commonly. And so let's talk about the top 10 cities with roundworms, right?
Let's
so I'm
do
just going to throw out a few to you. Let's see what you think, okay? Right. So the number 1 city for roundworms is Charleston, West Virginia.
All right.
Then we have, let's spread it around. We've got number 5, Little Rock, Arkansas. Right?
Okay.
Number 6, Miami, Florida.
Warm and hot.
Right. 7, Memphis, Tennessee.
Also warm and humid.
Right. So, and even number 2, Mobile, Alabama.
Yep.
So let's talk about the trend of all of these places that I just named.
So all of the top 10 are under the 40th degree of latitude. So they tend to be in warm places and often humid places. So Mobile, Alabama, number 2.
Not only bad for hair, for curly hair, but bad for
parasites too.
Yes,
yeah.
Agreed.
So Mobile, Alabama, not only is it warm, it is actually the city in the United States that gets the most annual rainfall, more than Seattle. So warm and humid, that's the roundworms thing.
Wow, really?
Yeah.
That's amazing. Okay, I did not know that. So what do our vets in these areas, do they need to do anything special?
I think it's just being vigilant and doing the stuff that we were taught to do, but always remembering to do it. And again, conveying the importance of this to our clients. So it's a health concern for the pets. It's a health concern for the clients. It's a health concern for the community. So roundworm is a public health issue, and trying to make owners aware of that could be really important.
Absolutely. Absolutely agree. So it all comes down to education. Sounds like,
usually does.
It's a common theme. Using the right products, testing appropriately.
Absolutely, yes.
Right? And being super vigilant because the top 10 places are certainly warm and humid.
Yes.
Got it. That's pretty concise.
Yeah.
Yeah.
Probably also worth highlighting, though, it's not just the warm, humid places.
Oh.
So certainly we see roundworm everywhere in the United States, but we also have animals coming from warm, humid places to the rest of the country. So being aware that pets are moving around the country more than they ever have, both as pets traveling with owners and as pets coming from the south up to shelters in the north that may not have as many adoptable pets. So just being aware of it, even outside of those areas, is important.
100%. As a matter of fact, I adopted a dog from my own service here who was from North Carolina.
All right.
Very different climate than what we generally have in the Northeast. So
Winston-Salem, North Carolina, number 9 on the list for roundworm.
Gosh darn it. I probably need to do another fecal.
Codemon deacons.
Yeah. So interestingly, I was reading a study by the EPA, the Environmental Protection Agency, not to be confused with the European Poop Authority. Just kidding. That's not real. That 40% of dog owners in the U.S. do not pick up their stool their pet stool on walks. And I am a little bit alarmed by that number because, of course, we're talking about parasites that are very prevalent, and a lot of them are spread through fecal oral, right. Contamination. And so how do we help prevent that?
I'm not sure if that 40% makes me worried or if that's actually an optimistic estimate. My guess would be more than that. So I'm actually surprised.
Very valid.
So as with so many things with parasites and poop, it comes down to good hygiene. So these are fecal oral transmission by and large. So making sure that clients are picking up the poop, making sure that they're picking it up promptly, letting it sit for a couple of weeks and then scooping it up, they've made it into the topsoil at that point. So really, really being diligent about doing it in the moment, even if it's raining out, doing it. Making sure they're picking it up and making sure that they're doing it in a manner that protects them as well. So good practices, I think it's common sense for everyone, but making sure you're not coming into contact with the poop is key as well. And then thinking about what to do with it when we dispose of it. So it's so common to go on a hike and find that somebody has gone to the effort of picking up the poop, tying the bag, and then leaving it. And those bags decompose, and guess what? Once they do, there's the poop again. So making sure you're disposing of it properly. And there are some municipalities that are doing some really interesting things with vermicomposting. So taking the poop from dogs and actually turning it into something that you can put on crops. And the composting process actually kills the parasites.
That's brilliant.
So it's still kind of uncommon, but be on the lookout because that might be a really good solution for the increase in dog poop that's happening as we see more dogs.
That's super neat. And like a really brilliant way to help, encourage being greener and using something that we generally wouldn't use. And I have to tell you, as a practitioner, I don't think I ever asked an owner if they're picking up their dog's poop on a walk. It escaped me. I don't know if you felt the same way.
I am guilty of that as well. It's never occurred to me, but it's really important information for the client, for their pet, and just for public health in general. 100%.
And I'll also admit, I've been on walks out here, in the country, enjoying the scenery with my dog, and my dog will poop, and I have my little bags and my cute little carrier. And I have people say, "Really? You pick up the poop?" And I'm like, "Yes, I do." Because it's the appropriate thing to do. But it's interesting to gauge their reaction, right? Because they think it's natural. It doesn't matter. Right? And so I would say in that same vein, if we're encouraging and again, educating clients on making sure they pick up their dog's stool, that we can kind of review the tips to make sure they keep on preventatives, to make sure we take care of those parasites, right? Like maybe reminders, and whether or not that's a reminder through the phone, which may be a little bit labor intensive by leaving, calling owners and leaving them messages, or if we could do something that's app derived, which would be really neat for some of our, young clientele. Again, a large proportion of which have pets, like you millennials. And, maybe for our older clients who aren't computer savvy or smartphone savvy or aren't on social media, something where they could, take a sticker and put it on a calendar, even something that promotes our business with a logo. So we make sure that they're giving their preventative monthly.
Right. I know that's how my mother does it. She has the sticker on the calendar still, and that's how she remembers. So lots of different ways to make sure that people are being compliant with their parasite prevention. I think the other thing that's important to emphasize is that these preventatives are once monthly typically, and there's this thought that somehow it's killing parasites over the entire course of the month, and that's not really what's happening. So it's really, you give it, and for the day or two that it's actually present in the body in sufficient amounts, it kills whatever parasites have managed to make their way in over that interval, and then there's another 28 days where they're not truly covered. So it's important that it's given monthly because it's providing kind of that intermittent prevention and cure, not this constant low dose. It's not like a shield around the dog.
Gotcha. Again, I must admit something that I really didn't look into. I was like, hey, it's monthly, so at least we get probably the benefit of it being around for maybe almost 30 days, right?
Right.
So that's a great point, super important. So we really have to keep them on monthly preventative.
Yeah, it's really important to do it frequently. And talking about picking up the poop in the country, a lot of these are prevalent in wild animals as well. Trichuris vulpus comes from foxes. So we're never going to eliminate them entirely, But we can really protect the dogs and minimize the environmental load of those, and that's going to make everybody happier and healthier.
Absolutely. And wild animals are not only in the warm weather states. We have them everywhere. We have dogs everywhere. So be vigilant. If you're a veterinarian in those states with top roundworm burdens, obviously you're going to be super vigilant about making sure that your clients know about these things. But the rest of us still have to be vigilant about telling our clients about all of these things and reminding them about prevention.
Certainly.
Great. So Patrick, let's talk about heartworm disease.
Okay.
It's still out there. I think some of us, including myself in New York, are like, heartworm, just such a novel thing, right? Let's just do prevention, helps with GI parasites, right? But it's a real thing, and it's a serious thing.
Yes.
And obviously, we tend to see it in warmer weather states, like we see some other parasites, the south, southeast. But there are some surprising predictions from CAPC about where heartworm is going. So talk to me about that.
Yeah, so CAPC periodically puts out maps predicting heartworm for the next year.
Oh.
And the most recent map shows kind of the usual suspects. So south, southeast, some areas of kind of Arizona, New Mexico. Yeah. So the warm places you'd expect. But there are some areas that kind of surprised me. So parts of Idaho, Wyoming. Yeah, Montana, North Dakota. So really kind of that upper tier across the West actually is a relatively high risk of heartworm for the upcoming year. So some of these places that you don't necessarily expect, they don't kind of fit the bill of our classic, warm, humid southern state, are still areas where I'd be worried about heartworm.
Wow. So again, the conversation is becoming more and more important no matter where you're located. That's what I'm hearing.
It is. And we keep coming back to this theme, but there's also a lot more movement of animals than there used to be. And so dogs from unknown areas, dogs from the south, those are cropping up in places where heartworm may not be on your radar. So starting to really query where those animals are from and test and treat appropriately.
Absolutely. We're adopting dogs from all over the world, all over the states. And so something we really need to look into. And we really need to not forget about cats.
That's true. A lot of us forget about cats when it comes to heartworm disease.
And so super important for veterinarians to make sure that they're educating their clients everywhere about this. I mean, we should be talking about it here.
We should.
I know it's hard, but.
So for me, it's any cat with an unexpected, unknown source of coughing potentially could have heartworm-associated respiratory disease. So part of my workup for a chronically coughing cat is going to be not just the antigen test for heartworm, which is what we use to diagnose dogs, but also antibody testing, because cats often have very small worm burdens. Absolutely. And maybe not enough of a adult female population to generate the antigen needed to get a positive antigen test. But antibody testing is really, really important in cats. And it goes back to your index of suspicion. If you're not thinking about it when you see a coughing cat, you're going to miss it.
So please no jumping just to asthma.
Yes.
Especially a special focus in these areas, but everywhere. Not just like, hey, here's some steroids or something to help with them. Obviously, there are other medications we can help with, but not just assuming.
Right. And I've certainly seen cases of lungworm as well. So that coughing animal, dog or cat, could have lungworm. And I would say learn from my failures, because I have done bronchoscopy on a coughing dog only to see the worms in the lungs. So that was a $1,200 diagnosis for a $30 disease.
So in practice, I kind of got used to just doing a heartworm test and a Behrman fecal, just so I could rule that out.
Right.
Do you think that's a pretty good thing to do?
I do. I would say the ideal may be to do both a float and a Behrman. But if I had to choose one, the Behrman is going to be the one that's most likely to catch lungworm. Okay. One of the problems I've encountered is that Behrman is a much more expensive test at some commercial laboratories. So here we have the luxury of academia, where prices are sometimes a little bit lower for some of the more esoteric tests. When I was in private practice, it was really expensive to run a Behrman. So to me, if you're not talking about heartworm, if you're talking about intestinal parasites, lungworm, that kind of thing, a trial of fenbendazole. It's cheap, and it's going to tell you if you're barking up the right tree, because the cat will stop coughing, the dog will stop coughing.
100%. And this is a nod, I think, to spectrum of care. right?
Absolutely.
Not everyone can afford the gold standard. We all understand it, but rather than just saying, okay, well then we're stuck, we don't want to leave our patients without care. We don't want to leave clients frustrated who care about their pets. Then why not just consider deworming?
Right.
Absolutely. And I think there were some other surprises. I think you were talking to me about some other studies about heartworm in wild populations.
Right. So it's not just a disease of dogs, it's any wild canid. So there have been necropsy surveys in a variety of states. I know of one in Pennsylvania that showed a really large percentage of coyotes on necropsy were heartworm positive. So, where we are is not terribly far from the Pennsylvania border. I don't think of us as an area that sees a lot of heartworm disease, but it certainly should. It's coming our way, so I need to be thinking of it more often than I probably do.
Super unfortunate. And obviously, as the weather is now becoming warmer everywhere, I definitely think we're going to see more coming our way.
Yes.
And as that happens, then unfortunately, treatment is warranted. And treatment, as everyone knows, is not easy. I mean, and when you look at it on paper, it might be easy, but it is in fact not very easy, right? So we look at the Canine Heartworm Society is where I'll get my recommendations. And obviously these injections can be difficult. And obviously there's time beforehand where you have to give medications and then they have to be exercise restricted. There's just so much.
It's expensive and there's a lot that goes into it. And the injections hurt. Those dogs are painful. So it is really a big deal. The American Heartworm Society does a great job of laying out the guidelines. And if you diagnose a heartworm case and you've not treated them before, that's a great resource to go to. But it's still hard and you have to get the owner on board. You have to have good compliance over the course of several months to make sure that everything gets done appropriately and on time. It's a challenge. Absolutely.
And I've seen dogs that have formed, sterile abscesses at the injection site, and some have suffered some other consequences that I've seen. I've seen reports of like paralysis in the rear limbs. Obviously, that's a very extreme example. I learned about that when I was doing some rehabilitation training. But again, not simple, costly and not simple. So cheaper option.
Prevent.
Up next, something fun.
Hi, my name is Melissa Evans. I'm a licensed veterinary technician and a veterinary technician specialist in emergency and critical care, and I'm here to give you 3 tips for making a vaccine visit easier on your patients. First, use distraction techniques. Food's distracting to me, so just think what a delicious treat like peanut butter or spray cheese could do to distract an animal. Put a little bit of that in front of an animal's nose before giving the vaccine, and they won't even blink when you poke them with the needle. Next, use small gauge needles. Using a needle that's as tiny as possible will cause the least amount of discomfort for your patients. Last, whenever possible, use low volume vaccines. The smaller amount of vaccine there is, the less time the needle needs to be in your patient. For more great tips, follow me on Instagram.
So that brings us to the end of this episode of Vet Candy. I'm Michelle Moyal.
And I'm Patrick Carney.
Thank you so much for watching.
Not all preventatives protect your dog from heartworm disease and all 5 major worms, leaving a gap in their coverage. Close the gap with Interceptor Plus. Test dogs for heartworm infections prior to use. Reported side effects include vomiting, diarrhea, and lethargy. Interceptor Plus. Ask your vet today.
Hi, I'm Shannon Gregoire, and welcome to Vet Candy, the destination for everything vet med. Launched in 2019, Vet Candy has grown from a weekly email newsletter into a modern veterinary lifestyle brand and an indispensable resource for the best veterinary education. Let me show you around our website, myvetcandy.com, and show you how to keep up with everything vet med. First, let's check out our homepage. We have some great stories to keep you up to date on the latest clinical updates, scientific news, and expert lifestyle tips. We also celebrate amazing people who are making our world a better place. This is my favorite part. For those of you that are looking for exciting veterinary CE, look no further. We have some great stuff for you, and I promise, no PowerPoints and no webinars because we do things differently. Maybe that's why we have more than 1 million views. Now let's go to CE On Demand. Here you will find videos that are all race, New York State, and CPD approved for veterinary education credits. Vet Candy is the streaming platform where veterinary professionals can learn from the world's most exciting experts and top influencers. Stream anywhere, anytime, and at your own pace. What I love most is that our videos are studio quality, shot and edited in 4K so you can stream them in 1080p. And best of all, Vet Candy's entire collection of more than 75 continuing education videos can be streamed anywhere, anytime, for free. And you can also select up to 12 different languages to watch them by selecting the language of your choice in the subtitles. So, how do you get your CE credit after watching an eligible video? It's simple. All you need to do is watch the video and then pass the quiz. Click on the Take Quiz button. This is the button below the video that takes you to an online test. When you pass the quiz, you will instantly receive an email with a PDF with your certificate of completion. It really is that easy. Next, we have a variety of Vet Candy original shows, from talk shows to rounds and games. There's something for everyone, and we are committed to bringing in diverse voices and unique perspectives. Let's look at our master courses. We have 4 master courses right now, and more are coming soon. We have ophthalmology, which is taught by veterinary ophthalmologist Dr. DJ Heusler, toxicology, taught by criticalist Dr. Carrie Hemmelgarn, surgery, taught by board-certified veterinary surgeon Dr. Philippa Pavia, and respiratory disease, which is taught by Dr. Anthony Gonzalez. For our master courses, there are 8 modules for each course. Watch each module and then click on the link that says Take Quiz, and it will take you to an online quiz. When you pass the quiz, you will receive your certificate of completion of the course, plus a link to download some tools to help you celebrate and share your accomplishments. You just click on that link and it takes you to the tools. Next, let's look at Vet Candy Magazine. Vet Candy Magazine is a monthly publication for veterinary professionals. From the latest clinical updates to expert advice and so much more. And of course, our cover models are the most incredible and inspiring professionals on the planet. You can check out our magazines here on our website, or you can get them for free on Audible, Kindle, and Apple Books. Next, we have our podcasts. What I love most about our podcasts is that I can listen to them while I'm driving to work, on a jog, or even working out. And we have so many podcasts that you can listen to. Living Well with Dr. Jessica Turner is a show all about wellness and recovery. Her guests span from well-being experts to real-life veterinarians who share their struggles and challenges. Do you like comedy? Then you will love Desk Wench Confessions with comedian turned vet receptionist Caitlin Palmer. One of my favorite parts of her show is when she and her guests read revenge reviews and decipher what truly happened. Oh, and once in a while, Caitlin does break into song and even gets her guests to sing along. Vet Candy Rounds with the Hollies is all about rounds. We take you back to vet school with a mystery case and a special expert host to tell us the story. These shows are fun, and what happens at the end is always a surprise. Vet Candy IRL, hosted by yours truly, as well as Tatiana Rogers, a vet student from Colorado State, and Lexi Rodriguez, a Texas A&M vet student. Vet Candy IRL celebrates inspirational role models and focuses on empowerment and equality, including disruptive leaders who have broken boundaries to get where they are today. Vet Candy Life, hosted by veterinarian Dr. Quincy Hawley and veterinary technician Renee Michelle, is a show that focuses on physical and emotional wellness for veterinary professionals and students. We know that veterinary medicine is a stressful profession, and veterinarians experience a high rate of burnout and compassion fatigue. Each episode of Vet Candy Life features expert tips, lifestyle advice, and real-life experiences from the most exciting veterinary professionals in our industry. Vet Candy books are great resources. We have a selection that are RACE, New York State, and CPD approved for veterinary continuing education on a variety of topics from marketing to CBD. For CE credit, you read the book and then take the quiz. Click on the button that says Take Quiz. Pass the quiz on the online quiz site, and then you will instantly receive an email with your certificate of completion. You can check out our books for free on Audible, Kindle, and Apple Books. New for 2022, we created a page just for students to help them prepare for NAVLE in real life. On this page, you will see a variety of videos, books, and podcasts curated for students to make learning fun. We also have some great advice from Dr. Becky Lossing of Mini Mammoth, who helps make studying easier with time management tips. Vet Candy also created 2 digital books to prepare for the test: Vet Candy Prep, Cat Diseases You Need to Know, and Vet Candy Prep, Dog Diseases You Need to Know, each with a link to a quiz to test your knowledge. Want to stay up to date with everything vet med? Then you definitely want to subscribe to Vet Candy. We keep our tens of thousands of subscribers up to date on product recommendations, special offers, and clinical updates. To subscribe, you just click here and enter your email. So that's it for the tour of Vet Candy. I hope you enjoyed it, and thank you for watching.